Today we are going to learn about ergot, which is an indole alkaloid. So now this is the ergot. I have drawn it and I have also add a picture on the screen. The synonym of this ergot is ergot of rye or ergota, and this contains like 0.1 to 0.25 percentage of the ergometrin or the chemical constituents in this ergot. Now biological sources, dried sclerotum of the fungus, which is Claviceps purpurea Tulsane. Now this Tulsane, the discoverer, the scientist called Tulsane has discovered this ergot, hence on his name it is called as Claviceps purpurea Tulsane, and the family is Claviceptiaceae. Now what are the chemical constituents in this ergot? Now these are the derivatives of lysergic acid and peptide alcohols and other ergot main chemical constituents. Now these ergot chemical constituents are both in levo and dextro forms. These levo forms are active form and dextro forms are inactive forms. Now levo, generally these dextro forms suffix ends with "ine", okay. So levo is ergometrin, so dextro form is ergometrinine, ergotamine, ergocin, ergocrystine, ergocronine. So these are the chemical constants present in the ergot. Now when a plant is there, we need to identify it whether it is actual ergot or not, right? So the chemical tests are that when it is reacted with Van Uyck's reagent, it gives blue color. Now ergot when combined with ether, H2SO4 and sodium bicarbonate, it gives violet color. When ergot in the presence of water gives blue fluorescence. Now there is a specific test where ergot is reacted with glacial acetic acid. GA is glacial acetic acid plus ethyl acetate plus H2SO4. It gives blue color with red tinge. Now to this blue color with red tinge, if we add FeCl3, this blue color is changed to dark and this red tinge will faint, okay. So these are the 4 tests used to identify the ergot: Van Uyck's reagent, ether, H2SO4, sodium bicarbonate, fluorescence, and a specific test, okay. Now what are the adulterants when a biological source is there? These days we see the adulterants, right? So Claviceps microcephala, Claviceps nigricans, Claviceps paspali, these 3 are the adulterants of ergot. Now some of the important points to be remembered, like in point of view like the competitive exams, in that point of view we can remember these points, okay. So this ergot does not have starch and calcium oxalate crystals, it don't have these. Now what are the doses? Now in multiple choice we can expect these questions like ergot maleate can be given in how much dose, or which phase, which route, oral, intravenous, intramuscular, sublingual, or how many times it can be given. So these type of questions you can expect in competitive exams. So in that way ergot maleate, it is given in it is given at the composition is 200 to 400 mg, given orally for 2 to 4 times a day. Now ergot methyl malate, it is given at a dose of 200 micrograms intravenous at 6 to 8 hours interval. Then we have ergot tartrate, 1 to 2 mg sublingually, or it can be given as 250 to 500 micrograms intramuscular, that is subcutaneous. Then we have mesylates, ergot mesylates, it is given as 0.5 mg sublingually 4 to 6 times a day. And other important points to be remembered are the ergot of rye is also called as Saint Anthony's fire, and in the stage of dormant stage or scleroidal stage, when we harvest these this fungus, then we get higher concentration of ergot, and the artificial production is done by saprophyte, okay. Now this is the ergotamine chemical structure, and this is the microscopic structure, okay. And uses, coming to uses, generally the ergot means you have to remember something, it is related to uterus, okay. Generally it is related to uterine. Now it acts as oxytocic means stimulates uterine contractions while delivery. of a baby. Then analgesic, it is used as analgesic in migraine conditions. Generally ergot tartrates are used in analgesic migraine conditions. So as I said, oxytocic in stimulates uterine contractions, hence it is used to enhance the labor pain. Now in geriatric, that means in old patients, okay, we use ergot methane sulfonates or mesylates. So generally these are psychomimetic action which are behavioral in actions, okay. So this is about the ergot. We can see in pharmacology we have seen synonyms, biological source, chemical constituents, chemical tests, uses, adulterants, important points, its structure and the microscopic structure. Okay, we'll meet in other class.